One of the one of the common types of cases that we often see is we refer to as the misdiagnosis case, and that is kind of exactly what it sounds like. You go into the hospital because you're suffering from a headache, and you've got an 8 out of 10 pain headache or 9 out of 10 pain headache, and the doctor diagnoses you with some type of sinus headache or some other type of common occurrence without thinking about and considering some more serious options. And oftentimes, that failure to use what's called a differential diagnosis properly to identify what might be a less common injury or sickness that someone is experiencing, but could be much more serious if it is, in fact, that thing. We see that all the time, and those are misdiagnosis cases, and oftentimes those can be some of the most tragic because if it had been caught and the differential diagnosis had been done properly, that person would not have been injured as badly, and oftentimes that person might still be here. So the misdiagnosis case is one example. A second example is errors in communication, and this is another common one that we see often in hospital settings, whether it's during the course of a transfer from one hospital facility or one facility to another, there are miscommunications errors, there are failures to communicate between the transferring hospital and the receiving hospital. Often these miscommunication errors happen within medical facilities, within hospitals, where the nurse or doctor on one shift fails to give all the relevant information to the incoming team on the second shift, and that can lead to and cause problems and medication errors and all types of other things that can really result in serious damage to people. Do you want to talk about a couple other different types of medical negligence cases?
I do, and I want to add on to what you just said regarding miscommunication and add it can even be between a care provider such as a doctor and the patient, where the doctor hasn't effectively communicated to the patient or maybe their care provider or family member in a way that they know what they need to do to care for themselves or, again, their loved one. And of course, as you were talking, Xavier, those are so common that I'm sitting here thinking about the fact patterns in several cases we're working on right now.
Absolutely.
Another common area of cases that we see quite often are delays. And that can also manifest as many different types of delays. There can be delays in diagnosis where someone comes into their doctor and for whatever reason, the physician or provider just doesn't do much at that time to diagnose or treat the condition. And perhaps the patient goes home and doesn't return for days, weeks, even months to get further treatment. And it's delayed again, either the diagnosis or the treatment. Or it could be a delay that occurs all in one hospital admission, a delay in getting the surgeon involved, a delay in getting a certain type of specialty consult. For example, in certain types of cases, hospital providers need to recognize that certain symptoms and signs represent emergencies, and they need to get specialty types of physicians involved, whether that's surgical, orthopedic, neurologist, pulmonologist, etc. Was there a delay in getting the right folks involved? But delay can manifest in so many ways. We could literally talk about that all day. Finally, there's a complicated area that is common, but I think it's one of the most complicated areas to litigate, and that's surgical errors. Of course, surgeons are human beings, and sometimes they do something during surgery that is not ideal, or way beyond that. And of course, in our instance, what we're looking at is that deviates from the standard of care. The surgeon did something that a reasonable surgeon would not have done. Now, Xavier and I will say right now, slips of the hand are generally not good grounds for a lawsuit because, of course, all doctors are people too. But we're talking about surgical errors such as failure to protect certain areas of the body adjacent to the surgical area. Concrete example of that is if you're operating in the abdominal area, you must be very careful to protect the ureter. the tiny little structure that connects the bladder to the kidneys. And if you don't properly protect that, then that sometimes can be negligence. It often is not, but sometimes it can be. That's why this area can be so difficult to litigate, because you might have an instance of something that is negligence and an instance that just because of a few changes is not. So in those surgical error cases, what we often find that goes hand in hand with that is a failure to recognize the error when it occurs, and then a failure to properly handle that error. Because, of course, these things happen, but did you recognize it, and did you do all you could to mitigate those damages?
Yeah. And sometimes we find, Lindsay, that it isn't the mistake in committing the, as you call it, the slip of the hand. It isn't the nicking of the aorta or whatever other area of the body that the surgeon is operating on. It's the failure to timely recognize it post-surgery and say, they're not responding to this the way they in post-surgery the way they should be, and figuring out what happened and causing, again, as Lindsay was mentioning, delay and not getting back in there and figuring out what happened. And the delay is the malpractice and what ultimately we end up in litigation about.
I would agree, and I would think my final point on this would be many cases fall under several of these subheadings.
Yep.
Many cases involve a misdiagnosis that turns into a delay, or a miscommunication that turns into a delay. And sadly, sometimes, as we all too well know, an error can snowball and just roll on down the hill. And sometimes other negligence occurs to push that even further into the harm that occurs to the patient.
Yep.